The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. Today our show is about health and how during this pandemic our health is affected. My guest today is Kristy Bolha, and she is a physical therapist who is going to discuss how she is helping clients during this terrible time. And I want to welcome to my show, Kristy Bolha.
Hi, Susan. Thank you for having me.
I'm delighted to have you on the show, Kristy. You know, you are doing something very valuable. You know, today there are so many issues that people are going through as a result of this pandemic. And, you know, there is the question that people have is they can't do much about it because, unfortunately, you know, they're faced with all these issues of staying at home and, you know, not really doing enough exercise and being involved in things that really are hurting their bodies. Now, we're going to start off by really talking about your physical, as a physical therapist, why you chose that as a profession, because, you know, you could have done almost anything, Kristy. You're a very smart woman. So why? Let's, you know, kind of repeat that. Why did you choose physical therapy for a profession?
Well, I chose physical therapy as a profession going back to, I'd say, the age of 16. I had gone to physical therapy for the first time and was one of the unfortunate patients who was misdiagnosed. I felt at the time it was a very difficult time. I was an active runner. I ran long distance. I ran cross country, and I was very, very good. I went to physical therapy for patellar tendonitis, and 3 months later, I never got better, never had improvement, and had that 20 out of 10 pain that the physical therapist just wasn't able to address. So that started my thinking as to, well, first of all, what's wrong with me and why can't it be solved? So later on, I ended up finding out that I had a diagnosis of rheumatoid arthritis, which is classified as an autoimmune condition, and it's a systemic response. So at that time, I had wanted to become a PT because to help other people to get a faster diagnosis as a physical therapist. As you know, the profession is now, it's mandated that you have to have a doctorate of physical therapy to be a physical therapist. And so it enables us to be able to treat patients with or without a referral and have that knowledge base, that skill set to do what's called differential diagnosis. So someone can come in with either bilateral patellar tendonitis or rotator cuff tendonitis, and I'm able to assess them and differentiate whether or not they are appropriate for treatment by a physical therapist, or do they need other treatment? Do they need a rheumatologist? Do they need a neurologist? Do they need to go back to their primary care for blood work? So ultimately, becoming a PT was in order to not only be able to understand, learn, treat, and manage the pain that I was dealing with, but I also wanted to be able to help others and give back. I felt if I could treat my own ailments, then why not give that back to others?
Yeah, Kristy, I'm interested. You know, it's a very difficult field, and for our audience who are deciding or thinking about a career in their future, is it a very difficult profession? And how much do you have to know about the body? I mean, it sounds like you know almost everything about the body. And in fact, I mean, it sounds like you're almost a doctor, an orthopedist, because you know so much. But the question becomes, when you are young, how do you make the decision to become a physical therapist? Is it a really difficult profession, as I asked?
Well, it can be a very difficult profession because not only do you have so let's talk about pain. Most people will not walk into our doors unless either they're experiencing some sort of pain or they have something that is limiting them from doing something that they enjoy. So it's taking away from the quality of their life. And those things in their life, it's very emotional, it's very mental as well. So I find that the field is truly difficult because not only are you working with the physical ailments, but you're also working with that emotional and mental response to the whole, to the pain response system. So it definitely has an impact on the brain, and also whether or not the patient's going to recover quickly or whether or not the patient's going to need care for a more extended period of time. And as far as education, with the doctorate in PT, you basically have to know systemically. I mean, you go through pathology. So everything that the medical doctors do study, we also study as well.
You know, they said there's a song that says that this is connected to this and this is connected to that. And really, the whole body is like an organism that really needs attention. Now, this profession that you have, how has it changed over the last decade, and have the changes altered your approach to treating patients? Because I would imagine, I mean, we're talking about a digital age now, and so much has changed. Would you give our audience kind of an assessment of how it's changed for you?
Absolutely. So when I was first in school, this is going back 9 years ago, I went to the University of Pittsburgh, great school. I loved my education, and I feel they prepared me extremely well for my field. But then when you're out in the field and you're going through your experiences, and then you're also going through continuing education classes to renew the license, you continue to learn. And when you become a PT, you make that choice to continue to grow, to evolve as a professional, to give back to your patients. How I feel it's changed is I feel a lot of my experiences were traditional physical therapy, which is treating the pain, following the pain, treating the pain, and I kind of call that a Band-Aid. I don't want to, seem to, not to seem a little bit too hard about pain, but pain is, in essence, a signal of the body that something is wrong. So do we address pain? Absolutely. But the change that we've made is not just addressing the pain, but looking a little bit deeper into the root cause of the dysfunction. A lot of times pain is triggered by something not moving right. It could be a mobility restriction at the joint level, at the tissue level. It could be an instability issue. It could be a weakness around a joint, which is causing tightness, which is triggering a pain response. So everything is more or less related to function and movement. So whenever I'm assessing a patient, their pain level is kind of the last thing that I ask them. What I usually do is I'll kind of talk to them about what they're here for, what's been going on, when did it start, and then I always go into, what do you enjoy? What activities do you enjoy when you're not working, and what is it that you do for work? Because that gives me an idea as to how they're moving throughout their life. If I can get an idea as to what their movement patterns are throughout their day, it gives me an idea as to what really caused the problem in the first place. And then when I look at their movement and ask them to move, it usually a dysfunction will present itself.
You know, you talked about the word emotion. When people feel pain, it kind of puts them in a position where they're really scared. You know, pain makes people frightened. Pain makes people anxious. And I'm just wondering, how do you kind of deal with that? Because you're not a psychologist, you're not a psychiatrist, but, a physical therapist has to deal all the time with men, with women who've had operations on their knees, who've had hip replacements, things of that nature. And it's really difficult, I would imagine, when somebody is trying to heal and they're feeling tremendous pain. So do you talk to them? What do you say to them?
Absolutely. Well, I do the initial assessment and they talk about their pain. I usually will ask them what they enjoy, because a lot of times what they enjoy is one of the reasons why they're in the office in the first place. For instance, in South Florida, we see a lot of pickleball injuries. Older adults are loving to play pickleball because it's a more or less aggressive form of tennis. However, pickleball, tennis, golf, they're all rotational sports and rotational movements. So a lot of times when they're recovering from therapy, I'll talk to them and try to figure out what else they enjoy. And then I try to make recommendations as to things that they can do. Because a lot of times people become perseverative on what they can't do. Well, I just try and offer opinions as to, okay, look, I understand. Let's maybe take 2 more weeks off of tennis. But in the meantime, here are things that you can do that are physical. Because a lot of times they're missing that physical activity. So if we can find an activity that they can do relatively pain-free just to kind of keep them moving, that's usually what I try to recommend. I try to get them to find something within them, an activity, maybe doing something with a friend, just to get their mind off of the pain.
There you go. You know, today we're dealing with a real problem, and of course everybody knows that the pandemic is causing chaos. Now it's, you know, chaos is sort of a double entendre, because here it is. Number one, during this pandemic, people just stay home and they, you know, contemplate, if you would, their navel. I mean, so many different things is having an effect on people's bodies during this pandemic. So how do you feel that the pandemic has impacted individuals as far as their physical health and well-being? I mean, I would imagine that you see things and you hear things that you can't even believe.
Absolutely. So I think the first thing that we're seeing is a lot of stress and fear, which invokes cortisol production in the body, which cortisol production in the body places us in a disease state. So I try to, you know, I have patients that are calling me, asking me about what are our precautions, what's our protocol. And I just feel, honestly, if you follow the standard precautions, wear the mask, stay away from people, limit your exposure to activities, but it's important to also stay active, because the impacts of being sedentary and staying indoors, I truly believe it's bad for your health. Our bodies are designed to move. So in any way that we can move safely, or in any way that we feel safe about moving, is what we need to continue doing.
You know, you work for Miller Physical Therapy in Delray Beach, Florida, and, you know, everybody knows that working for a good company and really staying available to meet people's needs is very important. The Miller Physical Therapy, is it different than any other physical therapist? And if so, how do you think it is different?
I think it comes down to, well, I believe that any work institution, it stems from, you know, the, what's the word I'm looking for? It stems from like a underlying theme. So it always comes from the top, and it rolls down to the employees. So we all have to, in order to have a great institution, you have to have a team. There's no I in team. You all have to have the same beliefs. And so our team approach is that we believe in quality care. I've been in the field for 9 years, and I've always prided myself on, you know, being there for patients, being a good listener, sitting and taking that extra step, taking that extra moment to actually listen to somebody and waiting to respond. I think a lot of times, you know, we kind of get pushed through the healthcare system, and how we differ is we take that extra step. We take that extra time. You know, I'm there early, I'm there late, I make myself available on the phone, so I'm always around if needed. And if someone needs to reach me, you know, I make myself available for that. I believe that, you know, the practice is based off of the beliefs of, you know, the team, each individual, and then the group coming together as a whole.
Yeah, I hear you. You know, again, we're dealing with this pandemic, and it's a very unusual time for most people. What are you seeing clinically as a result of everybody working from home? You mentioned it before, but I'm just curious that, you know, it must be so different. I mean, 9 years you've been doing this, and then in the last year, everything has changed. How has it changed for you, and how has it changed for the patients? Well,
so I've seen two things. So I've seen the type of, we have those individuals who are always stuck in the office, who are now out of the office, who are working from home and have extra time to do self-care. And so they're able to actually really see that benefit of taking a step back and like, oh my God, like physical therapy has really helped me. I had a patient who was a college professor and constantly working long hours. She finally had some downtime, was able to take care of herself, and didn't realize how good her body could feel. So I'm seeing that type of patient. And then we're also seeing the type of patient who wasn't prepared for that home office setup and is starting to develop some either neck issues, some wrist elbow issues, just from poor posture and positioning at a home office that maybe was never set up to be ergonomically correct for that person to work from home.
You just mentioned the word ergonomics. I think that sitting in a good chair and knowing how to, put your hands on a control board for a computer is a very important thing. That is, from my standpoint, one of the problems that people are dealing with. They're on the computer all the time. From your standpoint, what could they do? Talk about the ergonomics that would really make people feel better.
Sure. Well, the first thing I see a lot of is with the aging process, our head likes to go where our eye gaze goes. And a lot of times if you're not getting regular vision checkups or your computer screen's too small, it causes us to slightly tilt our heads forward, which is called protraction. So we start to bring our head forward. Then if you kind of would take a picture of a side profile, you would see that our ears would come in front of our shoulders. So good posture would have our ears in line with our shoulders when we're sitting upright. So I always tell the person to have that screen directly in front of you, whether you need to put some books under the screen to raise the screen, or if you want to buy a stand, you don't necessarily have to purchase something. If you have old college textbooks, you can easily prop it up a little bit higher, so then you're already putting your head into a better position. And then a few other cues, just kind of, you want to keep your shoulders down and back and relaxed. So a lot of times when we're kind of reaching forward to look at our computer screen, our shoulders start to elevate, which activates that muscle in the back of our neck called the upper trapezius, which then can develop a lot of trigger points just from maintaining a certain position for a prolonged periods of time, which can then lead to pain and decreased neck range of motion. And then from the core, little cues that I like to think about is just tilting our pelvic bone up towards the ceiling so that we can kind of sit on a firm foundation and engaging the core muscles, which is your abdominal muscles, but not engaging it too much that you're pulling the navel too far in. You just want to think about bracing the spine and not sucking that belly button in.
Yeah. Kristy, we have very little time left in the show, and I always say to my guests, if you had the last word, what would you tell the audience? Because I know that there is a lot of advice that you could give to our audience, and I want to hear what you have to say. So, tell our audience and leave them with this last note. What is it that you want to tell them to kind of finish up the show?
I would leave them with, throughout my years of being in the field of physical therapy, also dealing with an autoimmune condition myself, and also being very active myself, I would say that the body has an innate way of healing itself. If you allow it the tools, the conditions that it needs to move better, to function more optimally, I believe that you can continue to function at a high level until the end of your lifespan. When I was 16 and developed an arthritic condition, I realized that if you can fully support the joints of your body by strengthening the muscles, keeping good flexibility, good motor control, good stability, it'll just help with overall longevity. I believe that movement, and not only movement, but your mobility is the key to longevity in life. It will prevent us later in life from falling and other adverse conditions that impact us with the aging process.
You know, my guest today is a real interesting person. She's dealt with a physical therapy organization called Miller Physical Therapy in Delray Beach, Florida, and she really has given our audience something to think about, because today everything is different. And I want to thank you again, Kristy Bolha, for being on the Susan Brender Show. It's been a great talk with you.
Thank you for having me.